I call upon Dr. Prithvi Chandrakanth, who will be talking on RETILIGHT.
Good afternoon, everybody. We're talking on the RETILIGHT. So as we know, as a veterinary surgeon, for us during surgery, the one most important thing that we need is an endo illuminator. So without a light source, it is very difficult for us to do a surgery. But what if the endo illuminator goes off and we don't have an illumination? That becomes a big problem, and then we'll have to even postpone the case or wait for somebody to change it. So this was the problem statement, and that's why we wanted a frugal novel illuminator device for emergency purpose. So that's why we came up with RETILIGHT. So basic principle is using a xenon light. It focuses light on the endo illuminator head. So even without a lens system, we can do that. So we designed two adapters, RETI adapter and light adapter. So these two adapters such that we can use the LED for illumination in one adapter and the other one for the head of the illumination. And it is such design that you can actually change the adapter and do a permutation combination to accommodate any of the other companies or any of the other devices like LEDs or torch light or anything, and just fix it and make it, you can use it as an endo illuminator source. So this costed around 1,500 rupees, and this is the 3D printed model that we have. So you can see how these two adapters can be removed easily, and then in one head you can put any of the endo illuminator from any company. You can design it accordingly. It is very simple to design one. And then the other side is has the LED light bulb, which can be even used with a small cell button also. But the illumination of this is a little lesser than the one which we have in our machines. So we thought, why not increase the illumination into a little more so that we can get better illumination. So that's where we came with the RETILIGHT 2.0. Here we used a better illumination LED, but then we required a heat sink and also a fan to reduce the heat, because as the light increases, intensity increases, we need a source, we need to cool it down too. And this can be used with the power bank which we have. So it's a 3.5 volt power bank which gives very good illumination. And as you can see, it can give you diffuse light, it can give you even a spotlight for orbit surgeries, and also this adapters can be changed accordingly if you want to use it for any of the endo illuminators. So you can see how beautifully you can appreciate the light coming through the endo illuminator. So this is a sample where we use this endo illuminator, and you can see how beautifully you can actually illuminate the retina, and you can go up with the surgeries. And even in anti-segment surgeries where you need retro illumination but you don't have the whole machine as a retina surgery machine, you can always use something like this, which becomes very handy for anti-segment. And also in orbit occuloplasty you have, we can use this for as a spotlight. Also we can use this for corneal DMDs also. So this is an ultra portable device which comes for 1,500 to 5,000 rupees. So as you can see, I use this, I keep this in the pocket itself, so you can just use it, very easy to portable also. Thank you. I have a device if you want to see.
Looks like a submarine. Don't. Okay. Yeah. You will answer some questions? Yeah. No, basically a lot of things are there like this, the excellent source.
Yes, sir.
So my only concern is, what about the light toxicity to the retina caused by this? Because we have got a lot of filters, and we have got what you call the virtual filters also in most of our machine, either it's red-free or all those things, thereby reducing the toxicity. So this, you have done any validation by doing maybe in any of your macular cases, maybe a macular hole or ERM, by doing ERG prior and post surgery. So
Yes,
what
sir.
about the toxicity in the presence of especially ICG or any other dye?
Yes, sir. So basically, we went back and saw the other portable devices which are there, which cost around 1 to 2 lakhs, and we opened up and saw the LED. So we exactly got the same LED that they are using, which has already been used in our standalone machines. So those which have been used is almost 12 watt, and which we have used here is just 6 watt. It is actually comparatively very less compared to this thing.
In between the light and your adapter, is there any filter in other machines? Because it is there in all the high-end machines.
Yes, sir.
Because when you see even in a Alcon machine, no
Yes,
financial interest, you keep the light on your gloved hand.
Yeah.
It will create a sort of a
Yes,
heat
sir.
burn. Actually.
Yeah, actually, which they use in Alcon is a xenon light. So that might require a filter and such. But what we have, we studied through other machines which use LED lights, it doesn't really require. And this LED is the same one which we use in the slit lamp also. The recent slit lamps which we are coming
But
with
that
LED.
is external actually, and you will not be focusing for 30-40 minutes inside the eye.
Yeah. It's the inside the LED inside the illumination source is the same LED.
No. What I am saying is in slit lamp, you will not be burning the
Yes,
retina directly.
exactly.
It is just
But this
outside.
is exactly the one which they use in the other box. The